All right, everybody. Here's Dr. Mallory Salentine, but I would like to do a formal introduction. So let me just kind of talk about briefly why we're doing this. And we have been having this conversation. I have having this conversation with other physicians in our space. And I noticed that many physicians like to do something outside of medicine or even in the medicine, something different. So I've been coaching some of the clients and, other colleague physicians, and I figured I want to show the examples of what's possible. And I think it will be very empowering and share the stories, how we're doing, and see how this can change our culture of medicine. So this is our first Instagram Live, and we'll see how things goes. And then I'm just going to get started, okay? All right. Hello, everybody. I am Sujin Lee. I'm a physician and life coach. Today, I have my colleague, Dr. Mallory Salentine. She's a pediatrician and also lead physician for her Physician Wellness Initiative program at her healthcare system. She also launched her consulting and coaching business recently. I think Dr. Salentine is a great example how a physician can leverage our skill sets as an expert in knowledge and experience, become a leader in our healthcare system, and also be as an entrepreneur to make a greater impact in our society. So here's Dr. Salentine. Would you like to introduce yourself?
Thank you, Dr. Lee. Thanks for having me today. I think you did a fantastic job with the introduction. Yes. I'm Mallory Salentine. I am a pediatrician, and I'm also a leadership coach, like Dr. Lee had mentioned. So I'm really grateful to you to be able to come on and chat about what I'm doing and what is possible for other physicians. So thank you for having me today.
Great. So how I like it about is I would like to share the story of my colleague physicians. So usually, can you share about how you started your career as a clinician or, leadership, whatnot after the training? How was the transition from the training to the first job and how you get to where you are?
Yeah, absolutely. So my transition from training to my first job went very smoothly because I was doing everything I was doing in my training. So I was working all the time. I was thinking about my patients all the time. I was charting all the time.
So oh, wow.
It was actually very smooth for me. And it took about 6 months before I realized, and someone actually stopped me, one of my colleagues actually stopped me and was like, you can't do this anymore. You're not in training anymore, right? You shouldn't be working all the time. So
you're working too much.
Yeah, so I would work all day in clinic, and then I would come home and I would chart all night. I would call patients. I'd be worried about patients. I'd be up until like super late at night charting, and then I would come in the next day and do the same thing all over again.
Wow. So you were like a very well-trained physician, actually, doing excellent job as a physician, how we were taught.
Yes.
And what happened after that?
Yeah, so then I realized that was not sustainable. So I think I was under a lot of stress. I was very worried. I was really nervous, like with it being, right out of training, my first job, seeing I was the one responsible. I felt like I was the person responsible for my patients.
Yes, we are in a way, yes.
Yeah. But we also share that responsibility, right?
Yes,
so,
of course.
And I share that responsibility with the parents. And when I started, I didn't feel that. I just felt like solely responsible. And if I forgot something to tell a parent, or if I asked them to go and get a lab or an image or something, and it wasn't done the next day, like I was like calling them and making sure they get that done.
Yes.
Well, I think I took a lot of responsibility on myself because training, when you are working in the hospital all the time, you kind of do get responsible for that, right? If there's like a lab that isn't been drawn yet, or there's an image that hasn't been done yet, like you're the one that calls the lab.
I know. You want to reel down the patient to the radiology department almost, right?
Exactly. So
we're supposed to do as a physician though, but I don't think we were trained that way, right?
Yeah, I think we took that responsibility on ourselves. So once my colleagues sat me down, I realized wow, I really need to make a change here to be able to do that is sustainable over a long period of time, over, the rest of my life till I retire.
Yeah, 20 years, 15 years, whatever that is, right?
Yeah. So at that point, I decided, okay, it's time to start really focusing on myself a little bit more than I've ever been for years. So I started to say yes to like everything I could that had to do with well-being and wellness. And, there was a mindfulness-based stress reduction course that was offered at my organization, and I like hopped on it immediately. And, we started a well-being committee, and I jumped on. So it was kind of like everything that would come up that we would get like an email about or a phone call about or something. I instantly joined it.
I see.
So that I needed to start focusing on myself, and I needed to start things that were shown to really help.
So that was your way of getting out of like a clinical burnout, focusing on your well-being that was offered from the hospital system. Is that correct?
That's correct. Because that's all, right? That's all time was what was being offered to me through my organization. Because I had spent so much time not focusing on myself, I didn't really know those other things that I could be doing.
I see.
Be helping. So I was really just kind of like, anytime something would come up that I would hear about or that my organization would tell me about, I would jump on it right away.
Well, didn't it add a little bit more of a burden in your time commitment though? How did you make that, balance or transition then?
Yeah. It increased the time burden of focusing on myself, but that was important to me. So that was what I wanted to do, was to myself and find what it was that I enjoyed, what it was that would help me be more well, what would help me give up some of that feeling of control that I had, those feelings of that I had. And so it was kind of like a transition, right? Like I started trying to leave work at work, right? And I was trying to get my charts done before I finished the day. And I was trying to open the electronic medical records that night. And so instead of doing those things that I was doing other things that were giving back to myself. So even though it was through it was still about me. It wasn't about my work.
So the training, the wellness training or the program, whatever your healthcare system offered, actually gave you some tools to finish your work and leave your work at work and actually making time for yourself. Is that right statement, if I understand that way?
I don't know that there were specific tools to get my work done. It was about changing my mindset around what I was doing, what was important for me to be well at the same time as my patients being well.
I see.
All be well without one of us really suffering.
That's a great point, that a lot of times us physicians so focused on the patients and we only take care of, we're more focused on taking care of the patients, we forget to take care of ourselves. As a consequence, we're not able to take care of our patients because I'm not well. I really glad actually seeing some of the changes in the healthcare system, kind of providing those kind of educations. But I still see a lot of our self-funded. Physicians look for like coaching programs outside of their institution, but I also seen some increase of the number. I think that's a positive movement, but I think we still have a lot to go in terms of those ones. So, I mean, it's very interesting that, you had that opportunity when you were having a hard time with the burden of the clinical work and you're kind of going towards the direction of a burnout, but you had the awareness that you need to take care of yourself and you found that opportunity. So that's very empowering. And well, then tell me about share us about how you made that transition from being a clinician to being a lead physician of the physician wellness initiative in your healthcare system.
Yeah, so that that I had mentioned that had started, I, again, right away joined it. And the following year, the leader of that group retired. And so again, still in my and yes to everything that had to do with well-being. And I realized through that year of working on myself and working on the well-being committee that I had great ideas of ways that we could support and remove barriers for our physicians. So I applied to be the chair of that committee, which then also helped me join multiple other areas around the organization that was working in well-being. And working with our C-suite executives on well-being as well. So it kind of was like this whole transition of just always working towards wellness for myself. And is, okay, now that we've kind of figured out that piece here, how can I help others in that same situation? How can I help my colleagues in my organization be well also?
So, I mean, I hear two things in here. So you continue to show up in the space that where you felt your next vision of helping others. In addition to helping your patients, you're helping yourself and keep showing up, help yourself. And then it actually brought to the point that you can actually help other colleagues at this point, right?
A lot of us went into medicine to help people, right? Like that's kind of the big thing, right? We're like, we want to help people. And so it was interesting that, you know, I was really excited to be a pediatrician and I was helping people in that space. And what I realized was that I wasn't helping people in this other space that was really important to me. And once I did that and was able to start helping myself and my colleagues and my friends, opened up like a whole new world for me. So now it's really great that I'm helping all of these different people.
I know. Everybody who is involved in the healthcare system.
It's so fulfilling to do this, you know, such different work. I mean, it's interesting to be working like with patients and focusing on their health, and then also working with our healthcare workers and how we can keep them well within the work culture. So it's been interesting, like I have, how do I say it? Like this like dichotomy almost of like helping both ends of the spectrum.
Well, it feels like you're actually able to take care of everybody, including yourself. So patient-physician relationship is, there's no physician care part of it. We just take care of the patient. And that kind of, that's how we learned during medical education. But as a attending, as a lifelong physician, probably that's not sustainable in our current healthcare system. So I see you made some transition in your career that by helping yourself, you kind of learned what can help other physicians. So now you're building the program. Where is that stage in your leadership in building your program in your healthcare system? How is it going? What does it look like at this time? And where do you want to bring that one to?
Yeah, so part of the building my leadership in this work was actually to go through a leadership development program. And development program included having a leadership coach. And I really had any experience with coaching prior to that leadership development course. And I really learned the value of coaching for professional development, for leadership, for culture change, for my own well-being. Really opened my eyes to what could be possible for myself and for colleagues and my friends, and also for my patients. And so I really got excited about that through that leadership development course. That was kind of how I made that connection to what I'm doing in my leadership and how I felt in my entrepreneurial journey as well.
That's very interesting, because now I see a little bit better where your motivation and why that you started your own business to help other physicians, right? Yeah. Well, now I can see that you're growing in your healthcare system as a leader, and then now you bring that one outside of your healthcare system so that you can reach broader, our community. How is that, the process has been looking like? How is it going, and what do you learn? What did you learn around it along the course of entrepreneurship?
Yeah, I think it's going really well. I'm excited about it. I hardest thing for me with entrepreneurship is what we're doing right now, actually. So not necessarily having a conversation with you, that part is really easy. And I love the conversations that we've had so far, but having the conversation live on Instagram is something that has been really difficult for me. So if you look at my social media, which most of you can't because I'm private, you would see that like over the past few years, I haven't posted anything. Like I never really put myself out there. I never really told people what I do outside of being a pediatrician. And so I think the most difficult part for me as an entrepreneur has been to put myself in the public eye. So that's really interesting. You definitely can see me on Instagram because now I have my business Instagram, which is public and everybody can see that. And on LinkedIn, you can see my LinkedIn is public. You can see that. But that I think has been the most difficult part for me in my entrepreneurial journey of really being vulnerable and putting in a public way. I definitely have always been very vulnerable, very transparent, very open and honest with anyone in my organization because that I feel like it's those qualities I feel like are extremely important as a leader. That's how I've always led. I've been very open, very honest, very transparent, very vulnerable. A lot of people within my organization know my story, but I had never brought that to the world. So that, as an entrepreneur, that's something that's very different for me, and scary and fun.
Yes, scary and fun. I totally agree with you. I have a question for that part though, because I am sure people who is watching this video having exactly same obstacles, and probably that's one of the biggest like obstacles that we need to get over with. So how did you overcome? Because you're now everywhere, and then you feel more comfortable being outside, and then share what you're doing.
Yeah.
How were you able to overcome that? Or it's an ongoing process, I believe. There's some days that you really don't want to put outside. That's how I feel. But what helps you to reach out people and how you made that? Because now it's different. Before you were very private, not sharing all the things out. You were not sharing those things outside of your container, but now you're going outside. I'm curious what helps you to go outside of your comfort zone.
I think there are a few things that helped me. I think the first one was that when I started really marketing and putting myself out there, the people that I was following were saying, you have to do this every day. You have to post something, right? And so when I first started, I was like, I have to post every day. And that is just like the reality of having a business, right? So day I was posting, and I think I got to like 3 months of posting every single day before I was like, yeah, I need a day off. So I think that was the first part, was like I was watching who I thought was the leaders in the space, and they were telling me you have to do this. And so I was like, okay, I have to do this, right? I follow rules. I do told to do. And so I have to do this. So I think that was one thing. The second really important for me was that I was only posting things that I felt safe to post. And I actually wrote out a list of things that I will not post, that I will like. And every time I post something, or I do a video, or I do a reel or something like that, check off that list. So I'm like, okay, it's not this, it's not this, it's not this.
Oh, I see.
And that helps me feel safe and feel like as long as I'm not doing these things that make me feel unsafe, I'm with posting these things. So I think that was really helpful for me in the beginning. Now I have and I'm like, I know what I'm posting, I'm going to put out there.
Yes.
But I think in the very beginning, I was scared to post, and I was scared of, getting comments or, all of these things. Okay. Haters. Yeah, right. And so I was like, okay, these are the things that I feel comfortable and safe posting, and these are the things that I don't. And if it meets the criteria of safety, then I can put that out there, and I can put that out and see. So I think 2 things were helpful for me. One was that had to do it every day.
Commitment. I hear first thing is commitment. You're committed to
Yeah.
reach out to people so that you can help the people outside of it. It's scary, and sometimes I really don't feel like to do it too, but it's like a self promise and commitment. And I really love that you're building your boundaries. But I feel that boundary would not have come unless you have that commitment, right? Because you learned your boundary by trying it and it doesn't feel right, it doesn't feel authentic, or it doesn't feel safe, then you don't do it. We would never learn those boundaries unless we are committed and try, right? Yeah. That's a great way to actually get started for all the physicians who wants to put themselves outside and then feeling that way. Probably that's the best advice that how they can get started with those two things. Well, I guess we've been talking for about 20 minutes now, so I kind of want to wrap up. So you went through this journey as a physician, employed physician. You're still employed physician, right? And then stepping into the leadership now in the entrepreneur. I'm sure there's many people who are in the position at any stage of those journeys. Any advice for who are looking into leadership, or any advice for who is looking into going into entrepreneurship? Any like some wisdom that you want to share?
Yeah. The biggest thing for me is being aware of what is happening for you and setting those boundaries, kind of like you said before. So these things I'm okay with, these things I'm not okay with, and being very honest with yourself and very honest with other people about where those boundaries lie. I think being honest with yourself about what you enjoy doing is very important. Well, so always going for something that you enjoy and not running away from something else is extremely important.
It's so good. It's about being authentic, right? Who you are and really listening to it. All ties into together because all this journey started because you're paying attention to yourself, right? Yeah, when you were kind of burning out with all this clinical work, you started the journey by taking care of myself. And I hear this theme throughout your career that you're continue to leaning in, and it opens up the doors to other opportunities. That's really great. All right. Yeah. I mean, thank you so much for sharing your experience. And this is like a great conversation. I think it's very inspiring for other physicians who is looking into leadership and entrepreneurship. I really love that your advice or how you overcome the barriers with the commitment and having a boundaries and being authentic. Those are three things comes to my mind with your story. Where, if anybody wants to find more about your services, what you're doing, where can they find about more about your work?
Yeah, so if you're on Instagram, my name is Mallory Salentine. You can see it here. You can follow me. My website is linked to my Instagram profile. It's Salentine Coaching and Consulting.com. And then if you're over on LinkedIn, I actually am doing a lot of posting on LinkedIn these days too. And I'm Mallory Salentine on LinkedIn.
I should follow you in LinkedIn. I'm not on that much of a LinkedIn. Yeah, I'm more on the Facebook, and then you invited me in this Instagram space. This is awesome. Now I feel like, okay, maybe I should go to LinkedIn, but I have to kind of have a boundaries. Commitment. Being committed in the social media space and knowing my boundaries, and we'll find our space where it's going to be a perfect place to be. And thank you so much, Dr. Salentine. It's a great conversation. I think many people will enjoy and learn a lot of little great tips about how to become a leader, how that leads to the entrepreneurship. I'll see you around, okay? All right. Thank you so much.
All right. Bye-bye.
Okay, bye.